Ylenia Angeli has only been able to visit her 97-year-old mother at a care home behind glass, well, most of the year. So with the second lockdown looming, she made the decision to take her mum, who has dementia, back home with her instead.
But when the retired nurse told care home staff of her plan, they called the police, who arrested her.
So let's just make this very clear. My nan, my 97-year-old nan here, who we have taken from the care home because we haven't seen her for 9 months, is now being taken back by force to her care home. My mother has been arrested. My mother is in the back of the car here. She is a nurse. She is a fully qualified nurse who is wishing to care for her own mother. And here we have an incredible use of police time to take my 97-year-old grandmother back into a care home where she is deteriorating, where we haven't been able to see her for 9 months. Nan, I love you and we are going to fight for you. Yeah, because do you know why we're not going to stop filming this? Because everyone needs to see how ridiculous the situation is.
Well, Leandra, along with her daughter, former Coronation Street star Leandra Ashton, who filmed that incident and who we could hear her voice, join us both now. Good morning to both of you. I've got to say, when I first watched this video, it's utterly heartbreaking. You know, I'm someone who believes the rules are important, that they are helping to suppress this deadly virus. We've been very vocal, obviously, on the programme about care homes and how appalling it was that they were basically thrown to the wolves back in the first wave of this. But it would take a heart of stone not to have enormous sympathy with both of you for that situation. When you realised, Leandra, that you were being arrested for trying to take your mum home, what did that make you feel like?
It was surreal. It felt as if I was taking part in some peculiar film that, you know, wasn't real at all. I was shocked. And I was very concerned, both for my daughter, who was so distressed, and my mother. So, yeah, I just had to try and keep calm for their sakes. The two of the people that I love so much in all the world, I felt I had to protect them both at that moment.
Ylenia, can you talk us through what happened? Because you hadn't been able to hug your mum for 9 months, had you? Since, it seems, before the lockdown. So when you went in, there was a moment, wasn't there, where you just felt you wanted to hold her. And then did it just... Had you planned to withdraw her from the care home? Or was it a sort of spur-of-the-moment decision?
It wasn't planned. We have been trying to go through the correct channels to remove my mother from the home so that she can be cared for by family. But unfortunately, we don't have power of attorney for her welfare. And my father died. He obviously didn't think it was necessary because my mother was fit. She was able to speak for herself, and he knew that family were around to care for her. So it wasn't planned. It was just the heartbreak of seeing my mother through the window trying to reach us, and a member of staff, I think, who didn't really handle the situation particularly well. And I simply couldn't bear it anymore. And all I wanted to do was put my arms around my mother and tell her that she was not abandoned, that she was loved. And it was an amazing moment to hold my mother,
Leandra, this is your grandmother. She's now back in the care home. Do you know how she is? Are you able to communicate with her at all?
No, we're not. And our worry is that she'll now be in isolation because, of course, if we were able to take her home, that wouldn't have been necessary. She should have been with us. So we're really worried that she's going to deteriorate further because she probably won't be taken out of bed. And for someone of her age with her dementia, we're just really concerned about what's going to happen to her. And I think what's really, really important to emphasise is that we are not alone in this situation. There are thousands and thousands and thousands of families in our position. And if something good can come from what has been some of the most stressful 3 days of our lives, then that's my biggest hope, is that some positive change and some proper discussion, that we start broadening this discussion away from one illness, because let's remember that Alzheimer's is still the biggest killer in our country. That's the fact. And heart disease is a second one. And yet we're so focused blindly. So I think we need to broaden the discussion and make it really about public health and about holistic health.
Let's bring in Dr. Hillary. I want to bring in Dr. Hillary here. Hillary,
Right.
This is a heartbreaking story, isn't it? I guess you can't have a situation where it's a free-for-all and every family can take their elderly relative out of a care home like that, because we're in the middle of a pandemic. But what is the common sense solution to this kind of scenario?
Oh, it's better communication. I mean, I feel sorry for every single party in this, absolutely everybody. I feel sorry for Ylenia there and Leandra. Very sorry for them, very sorry for their elderly mother, who must be bewildered and perplexed by what's happening. Obviously feel sorry for the care homes. Usually it's difficult to get patients into care homes, not get them out. They're not imprisoned in there, but there are rules and regulations that have to be followed. The care home is responsible 24/7 for that patient. And you're right, you can't just walk in and take somebody out without power of attorney. And the police have to follow the law. That's what they didn't want to be called to sort this out. It's about good communication. And, of course, we're very sympathetic about people wanting to go and visit their elderly with dementia in care homes, but also they are extremely vulnerable. Care homes are doing their utmost to protect their residents and their staff. They haven't got enough test and trace that is reliable at the moment. And it's a very difficult job for everybody. But, of course, I feel sorry for
Ylenia and
Leandra in that situation.
I just wanted to put to you, because I mean, just like Piers, just like anybody who listens to your story, and anybody who might have a relative in a care home, our heart is absolutely broken by the way that this panned out and what has happened to your mother, your grandmother. I received a message from a care home worker today, didn't want their name to be used, but they said there is another side to this. I mean, we haven't had an official statement from the care home that you're dealing with. They've declined to comment, but I just wanted to put this to you. The staff in the home will have been working insanely hard for the past year to keep all their residents alive, just as doctors and nurses are. They'll have been wearing PPE, taking precautions, risking their own health to look after their residents, trying their very best to keep them calm and as happy as possible while their families can't visit. They will have been their families, attending to their needs, emotional needs, not just physical needs. Residents aren't just locked in their rooms and ignored. They're treated with great compassion. I totally sympathise with the family, but the other side of this story is not being considered, and I'm sure all the carers in that home are feeling awful. I think probably a lot of care home workers feel shocked about what's happened to you, but also feel probably that they're in quite a difficult position at the moment.
Without a shadow of a doubt, the care workers are on minimum wage. They have one of the hardest jobs, I would say, in the country, and they work incredibly hard, and they do their best. But what we have found over so many years is that, unfortunately, there are some people who live in care homes whose needs can only truly be met with family, because someone like my nan, it takes 2 hours to feed her. 2 hours. Now, there's not enough time for a care worker to sit with her and feed her for 2 hours. So we raised a safeguarding issue, and we have tried to go through all the official channels, because very early in lockdown, like so many other families, we saw the level of deterioration in my nan. And yet this safeguarding issue has just disappeared. So as Dr. Hillary said, it is about communication. But at the moment, our social care system is not fit for purpose, and it hasn't been for many, many years. It needs to be properly funded. The care assistants need to have proper pay, and they need to be properly trained, because looking after the elderly, as my mum would say, she has experience of that, takes a huge amount of skill.
Well, I think the irony here is that, Ylenia, you're a nurse, you're a trained nurse, have been your whole adult life, so you know how to take care of people. It's not like you're someone who wouldn't be able to take care of your mother. I just think, like all these things, common sense should have come into play. It didn't need the police involvement. You should have been allowed to take your mother home. If that was my mother in a few years' time, I would absolutely have done exactly the same thing. And, you know, all right, it may be a technical breach of these rules, but common sense has to come into play. What happened to you, being handcuffed by the police in this country, was outrageous. I don't blame the police, they were called. but it's just outrageous. Thank you both for joining us. We appreciate it. You've raised a really, really important issue. And we're going to keep on this.
And I also want to say wishes to your mum and grandmother as well.
Of course, and to all the care workers as well. This is not a stain on you guys. Care workers do an incredibly heroic job for very little money in very risky circumstances with COVID. We get that. But come on, we've got to have a heart as a country, haven't we?